Okay, so to start the shoulder eval, we're gonna start with goniometry and range of motion. So first, to measure flexion, we're gonna start with the fulcrum in line with her acromion, and then the stationary arm in line with her thorax, and then she's going to flex her arm up as much as she can. And then we get that measurement. The moving arm is in line with her humerus. Okay, go ahead, relax. And she's at 125, so the normal range is 120, so she's good there. And then normally we would measure on both sides, but for the purpose of this video, to help with time, I'm just gonna do one side. And then while she's on her back, I'm gonna go ahead and do abduction. So for abduction, kind of the same thing. Fulcrum is in line with the acromion, and then stationary arm in line with her thorax, and then she's going to move her arm up and out to the side. And we're gonna keep the moving arm in line with the humerus. Go ahead, relax. And she is at 142, so the normal range for that is 120, so she's good there. So for internal rotation, we're gonna have them lying on their back, and they're gonna flex their arm to 90 degrees and their elbow to 90 degrees as well. Then you're gonna put the fulcrum in line with their elbow, and then the stationary arm is gonna be in line with the floor, and you're gonna have them internally rotate their shoulder as far as they can go comfortably. The moving arm is in line with their arm, and go ahead and relax. So the normal range for this is 90 degrees. She's at she's at like 55, so a little bit limited there. And then I'm gonna have her flip over onto her stomach. And first we'll do extension, so same for flexion. Fulcrum is in line with her acromion, and the stationary arm is in line with her thorax. And I'm just gonna have her lift up her arm behind her as far as she can go comfortably, and moving arm is in line with the humerus, relax. And the normal range for this is 60, and she's a little bit limited there as well. She's at about 30. Okay, so for external rotation, their arm position is pretty much in the same position as internal rotation. Their shoulder is abducted to 90 degrees, and their elbow is flexed to 90 degrees. Fulcrum is in line with their elbow, and stationary arm is in line with the floor. And you're gonna start them at 90. So here. Okay, and go ahead, externally rotate. Then you're gonna keep the moving arm in line with their forearm, and relax. And the normal range for this is 100 degrees. She's just a little shy of this. If we subtract 20 from 90 degrees, then she's at 70 degrees. Okay, next is the Apley scratch test, so go ahead and sit up. The first one, she's gonna cross her arm over her chest and grab her opposite shoulder. This is looking at horizontal adduction, internal rotation, and protraction. And then the next one, she's going to reach her arm over behind her head to reach the opposite shoulder again. And this is looking at adduction, internal rotation, retraction, and downward rotation. Go ahead, relax. And then the last one is behind the back, trying to touch the opposite shoulder blade. Yeah, go ahead. So if she reaches behind her back, just like that, that's looking at abduction, external rotation, elevation, and upward rotation. Then to test active range of motion for flexion, they're just going to raise their arms up straight as much as they can. Good. And relax. And the normal range for that is 170 to 180 degrees, which it looks like she got there. And then for extension, they're just gonna reach their arms behind like that and get relaxed. The normal range for that is 50 to 60 degrees. And then for abduction, they're gonna make a snow angel like this. Good. And relax. And the normal range for that is 170 to 180 degrees. And for external rotation, you're gonna have them start with their shoulder abducted 90 degrees, elbow flex 90 degrees, and then external rotation, you're gonna have them lift up. Good. And the normal range for that is 90 to 100 degrees, which it looks like she's able to do. And then for internal rotation, start at the same point and then pull down. Good, relax. And the normal range for that is 80 to 90 degrees.
Okay. So today we're going to be doing manual muscle testing for the glenohumeral joint and the full shoulder complex. So first we want to look at is a range of 0 to 5. And if the individual can do it on their own without resistance, you can assume that they're automatically at a 3 because they're working against gravity. So can you do me a favor? We're going to go through shoulder flexion, lift out straight in front of you, as high as you can, and then straight down. Okay. Now, if you can go and reach behind you with a straight arm. Cool. And then back. So that's for flexion and then extension. Now, what we're going to do is flex up. Or here, yeah, flex up against me. Go, 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 go. Don't let me break you. Okay. So then at that last part, as I just did, we do a break test to see if the muscle can splint the area. Then I'm gonna do the same thing. Now extend back, extend back, extend back. And don't let me break you. Good. Okay. So that's flexion and extension. Next one, now we're gonna do AB and adduction. So lift out straight to the side like a snow angel. Okay, and now lift straight back down to your side. Cool. Now, do me a favor, lift up against my resistance. Lift up, lift up, lift up, lift up. Good. And then hold out right here. Now push down, push down, push down, push down, push down, push down, push down. Now that's through AB and adduction. Okay. Next, we're gonna go into internal external rotation. So for the purpose of the video, to make sure it's not super long, I'm gonna test one side, but typically you would wanna test against both. So I'm gonna bring her into internal first and have her go and push into external. Go ahead and push into external. Push, 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 all the way. And don't let it break you. Good. Now from here, we're gonna reverse it and go into internal. Go ahead and go in and push down against this hand. Push, 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 push. Don't let it break you. Good. Okay. Same thing, we're looking for 0 to 5. Okay. Not lastly. Next, we're gonna go into horizontal AB and adduction. That's going through this point right here. So go ahead and go bear hug. Cool. Now try the other way. Okay. And now bring your arms all the way back and try and reach as far as you can behind you. Okay. So we have horizontal adduction when she goes into a bear hug, and you have horizontal abduction when she goes out wide. Okay. Next, we're going to go into scapular movements. Okay. So if you can lay on your stomach. Just make sure your patients have their shoes off on these nice tables. Okay. So what I'm gonna have you do is bring this hand and go the back side of your hand against your low back. Okay. So now what the patient's gonna do is they're going to try and lift off their hands, and I'm going to be on the opposite side and try and push their scapula away from the midline. And ready, go. Okay. So that is for scapular retraction and downward rotation. So now if we look at scapular retraction and upward rotation. So now we go into here. Can you scoot to the edge of the table, friend? Okay. So now similar thing. I'm going to be on the opposite side of the patient, and sorry, I'll wait down. Okay. Now what they're going to do is with a straight arm, they're going to strictly just try and retract their scapulas together, like so. And I'm going to push away and go. And only break you. Good. Okay. So now next, we're going to go into protraction and upward rotation. So if you can flip over onto your back. Okay, so this one's going to involve a straight arm, and I'm going to be supplying force not above the elbow, but just below it. Okay, so go ahead and push up, and don't let it break you. Good. Okay. And then lastly, we're going to go into depression and retraction. Okay, can you flip over onto your stomach one more time? Okay. So, and scoot to this edge of the table. Okay, so this one, the patient is going to be lifting into shoulder flexion, going out in front over their head, and I'm going to push, try and pull them down and in towards the midline. And ready, go. Okay, and that's the manual muscle testing for the shoulder and the shoulder blade.
Now we're gonna go over the special test for the shoulder. So first we have the AC traction test. So you'll take your patient's arm, have them at like a 90-degree angle and holding above their elbow or Oregon process. And you're just gonna be pulling down. And what you're looking for is gonna be a step deformity or pain. And then next we'll do AC compression. So you'll have both of your hands on each side of the acromion process, and you'll just compress both sides together. And for this you will test for pain and instability. And then next you have the piano key sign. For this you should be in front of your patient, but to show you would find your AC joint of your patient, and just press down. And if you'll feel a springing feeling or some pain indicating in an AC sprain. Next we have subacromial impingement tests. So first we'll do the painful arc sign. So kind of have you just raise your arms like a snow angel. And if they feel any pain at the top or coming down or throughout, it'll be the sign for a subacromial impingement. And the next is near, so we'll have your hands out in front of you, thumbs down, and then start from the bottom. So have your hands up here and then raise all the way up.
All the way
Yeah. And then if there's any pain anterior or lateral on the shoulder, it's a sign of a supraspinatus impingement. And then scapular cyst, so for this I'll have to be behind the patient. One hand on the superior border of the scap and one hand on the inferior border. And then I'll have the patient raise their arm like a snow angel again. And then I'm helping the patient while moving their scap. And if the pain decreases or if the range of motion improves, then it's a positive test. Then next we'll have a rotator cuff test. So I'll have you raise both of your arms again like a snow angel, slowly all the way to the top. And then both of them come down at the same time. And then if one arm is coming down faster than the other, then it's a sign of a supraspinatus weakness. And then we'll do empty can. So both arms in front of you at like a 30-degree angle, thumbs down. Then don't let me break you down. And if there's any weakness or pain, that's also a super weakness. And then full can test, same thing, but your thumbs up. And then don't let me break you. Good. And then if there's a break or pain, it's a supraspinatus weakness as well. Then we'll have Gerber lift off. Can I have you turn around? So you have the patient's hand on your back all the way across, like under your scap. There you go. And then you have them try to lift off their back as far as they can. Good. And then you can also use resistant methods. You can resist against me. And then, well, she's able to do it. But if there is an inability to do it, that's a subscapular weakness. And then now we'll have bear hug, which is another subscap test. So hug one arm across your shoulder and hold it there. And then don't let me pull you out. Good. And if they are unable to hold it, is also a subscapular weakness. And then external rotation lag, so you'll have your patient in again a 90-degree angle, and then you'll pull them in external rotation. Don't resist it.
Oh, okay.
Yeah. All the way, the external rotation, and then you let it go and hold it there.
Oh.
Hold it there, don't, yeah. Okay, and then if they would come back, that's a sign of the lag or a teres minor and infraspinatus weakness. And then horn blowers is you'll have them here, also 90 degrees, then pull them all the way external rotation, hold it there. And then if they were to come back, that is also a teres minor and infraspinatus weakness.